Get ready to dive deep into the world of resilient kids as we explore effective strategies to help your children thrive in today's fast-paced world. You won't want to miss Dr. Song's expert insights on building resilience from the inside out. But there's more. We're also shedding light on the hidden dangers of benzoyl peroxide, a common ingredient in skincare products, in our toxin taming segment. Plus, we'll be busting a classic medical myth about gum that might leave you speechless. Stay tuned for an episode packed with essential information for your family's health and wellness journey.
The Discovery Doc Podcast, where your journey to empowered, non-toxic living begins. Join me, Dr. Cece, a doctor of nursing practice, self-proclaimed toxin tamer, and mama of four, alongside
me, Anna Kate, your medical mystery overachiever. Together, we'll uncover the latest in functional medicine, debunk health myths, tame toxins, and provide practical tips for thriving in a modern world.
Get ready to take control of your health with expert insights, raw stories, and actionable wellness strategies designed to help you and your family lead vibrant, toxin-free lives.
Let's discover together. Welcome to the Discovery Doc Podcast. This month, we are joined by Dr. Elisa Song. Dr. Cece, please tell us about Dr. Song.
Yes, we are so excited to have Dr. Elisa Song on our podcast. Please welcome her, guys. She is an integrative pediatrician and a functional medicine expert, and most importantly, a mama of two. But she's dedicated her entire career to helping patients and practitioners bridge the gap between conventional and holistic pediatrics, which holds a very special place in my heart. So please welcome Dr. Elisa. We are so excited to have you on.
Thanks so much. I'm super excited to be here. I'm glad this is all working.
Yes, we've had hiccups to get here, but we are here. As always, we show up. So we just want to dive right in and ask you how your journey specifically led you to kind of step outside of that conventional pediatric box that we are taught and focus more on holistic wellness for kids.
Yeah, so my journey is a little different than I would say many conventional docs who then veered into a more integrative approach, because a lot of docs and conventional practitioners, whether, you're a PA or nurse practitioner or even for me, I have friends who are in the chiropractic field, very conventional, and yet when there's a health crisis with their family or, themselves, perhaps conventional medicine didn't meet all of their needs. And so you had to kind of seek additional outside of the box care. Now, that wasn't my story. I mean, knock on wood. For me, I always knew I wanted to work with children. So that was a given. Like even in high school, I'm like, I want to do something with kids. Well, I should back up and say, at first I wanted to be a vet. And I think they're very similar. You get to take care of cute little things, except animals don't really grow up. So anyhow, I always want to be a caregiver of some sort. And so, when I went to college, I was thinking about what that meant. Is that a teacher? Maybe I was really into public advocacy. I thought, well, maybe I'll be a lawyer. And I was all set. Actually, my junior year, took the LSATs, and I was going to be on Capitol Hill fighting for children's rights and really, becoming a children's health advocate. And then, as life would have it, there's the messenger comes when you need it most, right? And so I remember walking around campus and seeing this flyer. This is in the late 80s for this organization called the American Holistic Medical Association. I'm like, what is that? I mean, this is in the late 80s. I mean, I didn't know what holistic medicine was. So I drove myself down to the convention center in Santa Clara, and I heard from people who were just starting to get known, like Andrew Weil, Deepak Chopra, Joan Borisenko. I learned about mind-body medicine and this idea that food could actually be medicine, and I was hooked. And so right then and there, I switched paths, and I remember calling my mom and saying, you know what, I think I want to be a naturopathic doctor. And she was like, what's that? Because back then, again, it wasn't really that well known as it is now. And so nobody ever discouraged me from that path, but also nobody ever really encouraged me. They didn't know. And they said, well, maybe you should, go to medical school. We know that. And then you could kind of pursue these other, avenues. And so that's what I did. I mean, always with the mindset that there's got to be something more than conventional medicine. We take the best of conventional medicine, but we know that there are so many other ways that we can help our kids thrive.
Yes. That is so, I love that. And I love that you share that journey because from my experience, that's very rare. I find it's very rare, especially for MDs, to go into the field right from the get-go. Normally, I find that MDs specifically, like you alluded to earlier, have to go through kind of something that brings them to more of a holistic stance. And so for you to know right off, like right out of the gate, that that's what you wanted to do, I love that. And I think that's very rare, honestly.
Yeah, and I had my fair share of kind of sideways glances, and my friends in residency, like, oh, that's it. Any patient who wanted more quote alternative medicine, like, oh, you should see Elisa, go to see Dr. Song. And so there was some level of tolerance because my friends in residency and my attendings, they knew I wasn't completely out there. They knew I had a good head on my shoulders, but it wasn't that accepted. So it was it was a little bit of a lonely road at first, but now there's so many more, and we need more and more. And that's what keeps me going, because there are more pediatric practitioners who are coming out and saying, hey, look, I want to find another way. I just need the guidance. And so I've been blessed to be on this journey now for, over 20 years. And I love teaching parents, and I love teaching practitioners, because this is the only way that we really should be practicing medicine for our kids.
I completely agree. It's so for me, my struggle with Lyme disease for 6-7 years was what led me, and I was in school, becoming a nurse practitioner in school. And when that was all happening, and I went to 30 plus conventional doctors when I was living in Florida, misdiagnosed, undiagnosed, etc. And finally, when I turned to a naturopath, that's when I found that solution and the answer. And so while I was still in school, I kind of tailored or tweaked the direction that I was going, but I still had to do what my school made me do, and go to clinicals and go that conventional route. I could tweak it a little bit towards the end when I chose things like my dissertation, or where I did more of my preceptorship. But otherwise, it was very conventional information that was coming my way. I'm curious, when you chose more of the holistic route to begin with, how did that impact, one, what you were learning in school and your views of what you're learning, and two, how did that impact you coming out of school and either applying for jobs, or were you able to kind of fall into a job that you aligned with well, or did you have to go through a conventional route first?
Yeah, such a great question. It's such an evolving process, and where we are now in the integrative medicine world is very different than where we were at, even let's say 10 years ago. When I finished my residency, 20 years ago, right? I was a resident in 1997 at UCSF, and I finished in 2000. That is, almost 25 years ago now, right? And this idea of, integrative medicine wasn't even around. It was considered complementary and alternative, like something you do on the side, right? Also the idea of evidence-based medicine was just being discussed. And so we know that now the definition of evidence-based medicine is really a three-pronged approach, taking the best that we have in the literature with patient preferences and clinical experience. And so, knowing that, I've had to pave a lot of my own way, but, back in the, mid 90s when I was in med school, late 90s when I was in residency, there wasn't a lot of information about the microbiome, right? There wasn't a lot of information about food as medicine. We were just really understanding that. And this whole field of personalized nutrigenomic medicine didn't exist. We're in this place now where we have this fascinating opportunity to have personalized medicine, but it was a journey. When I was in residency, my clinic, my primary care clinic as a resident, was with a preceptor and attending who was so open-minded and so supportive of me having discussions with patients about maybe waiting on antibiotics, for an ear infection. This is even before the AAP guidelines had really come out on watchful waiting. Having a rational discussion around vaccines or around, treatment options. And so I built up a patient panel that was in San Francisco, very interested in being grounded in conventional pediatrics, like having the option, like, hey, when antibiotics are really needed, okay, they know that I'll be able to prescribe them. But they also knew that I wouldn't prescribe them just kind of willy-nilly, that I was thinking about what the other options were. And so when I left residency, I didn't know what I was going to do because I didn't see a path forward that would allow me to practice in this way. And so I actually decided at that point that I was going to go back and get a master's in public policy, not public health, but public policy. Because I'm like, you know what? Why don't I take this knowledge and go back on Capitol Hill? Because I did a whole bunch of lobbying in medical school residency. And then, again, the right teacher, right at the right moment. And this was, early 2000s, I stumbled across another flyer. And this time it was for the Food as Medicine conference in Berkeley. And I went, and again, another pivotal moment where my mind was blown. And I heard from a very young Mark Hyman back then on this concept of functional medicine.
Yes.
And I'm like, what is that? And so I'm sitting there just like in awe. And that's again where I knew, okay, this is my path forward. And so, I did additional training in functional medicine. There wasn't even a certification program back then. There was, one course that I took, and I applied it myself to kids. I took, acupuncture courses, essential oil, homeopathy, herbal medicine. I'm like, I got to learn more on how to help our kids. So when I started my practice in 2000, it was as an integrative functional medicine practice. So, I mean, I had my share of, working in the NICU and, doing urgent care, moonlighting, where, I mean, literally, a patient every 5 minutes. And I remember this one night, it was just, you could barely, I have so much empathy for these docs in the middle of the winter where, literally the piles of charts are lining up and you have, 4 hours to see the 40, 50 patients that are waiting to be seen. And so what else can you do in that short amount of time, but offer a prescription, right?
Right.
And so, but there has to be another way. And so when I started the practice, it was really with this in mind, that we need to give our patients time, to tell their stories. We need time to unravel their stories and come up with a treatment plan. And we need to figure out, if a child's well, how do we, in this modern world where there's so much chronic disease, help prevent some of that? Or if they're starting to show things like a little behavioral concern or eczema or, frequent illnesses, what can we do from that really kind of root cause standpoint to get them well?
Right. That is, for me, it was, you're so blessed to have had someone who was willing to have those conversations throughout your training and throughout your schooling. For me, it was very conventional. And it wasn't until I personally was kind of, saying, oh, hey, there's something more here. I wasn't getting the answers over here. So I need to pivot and turn a corner. And wow, this is about actually healing. It's not about masking the symptoms. It's about healing, really digging to root cause, finding out what is going on and not just slapping, a diagnosis on me and saying I have to take a prescription for the rest of my life. So it was very much my own journey that swayed that. But then on my own, alongside the conventional schooling, I had to be the one to kind of retrain myself. Okay, just looking at a CBC with basic kind of LabCorp reference ranges and parameters. Okay, hey, that's Sick America. Those are averages of Sick America. So what am I looking for that are little yellow or red flags for my patients that are smaller? Like, where is the optimization within those reference ranges? And I had to kind of finagle that and learn that and pull from all different seminars and webinars and conferences and kind of learning on my own. So to have somebody that you had in schooling, that's amazing.
Yeah. No, I definitely feel so blessed. And my friends for residency, who are still some of my closest friends, are still very conventional pediatricians. But for them to really, start thinking, especially after reading my book, wow, I didn't know that's what you did. And that's so interesting. And, really kind of not necessarily seeking a broader path, but at least being more open-minded to it. And, I feel like, in this day and age too, we are at the tip of the iceberg of our knowledge. And even as integrative practitioners who have already taken the leap outside the box, we have to continue to question what we know and continue to dive into the research. It doesn't just stop here, because I also know some integrative docs who are kind of grounded still in what they learned 10 years ago. It's like, well, things have changed. Precision medicine has changed. And so we always have to have that kind of scientific mind, that mindset of I'm always forever a student, and be open to saying, you know what I did 10 years ago, it was the best I knew to do at the time, given the knowledge that we had, but now things are different. And I'm going to pivot and do things a little differently.
Yeah, there's one great point in there, and we actually talk about this in an upcoming episode, with certain common practices or standards of care derived from literature that is from the early 1900s or events that were happening from the early 1900s. And we have other countries out here that are saying, no, that literature is outdated. We don't use that as a quote unquote preventative measure anymore because it's outdated and not proven to be needed. And I do think the US kind of lacks in that categories. We just establish something as common practice and then continue it, through the duration of time, never ending time.
Yeah. Well, even think about, the ear infection guidelines, and the first ear infection guidelines from the American Academy of Pediatrics were, over 20 years ago. And the recommendations then were for, a well-looking child in front of you, or, moderately sick-looking child in front of you, for the vast majority of ear infections, the recommendation is to wait and watch, 48, 72 hours before starting antibiotics. Well, that hasn't necessarily trickled down into clinical practice, right? And part of it is, I think, for physicians and for parents, they don't know that there are other options as well, right? Because when your child is screaming in pain and, and you just want to do something, if you don't know that in the evidence, garlic ear drops have been found to be just as effective. And then there are homeopathic remedies that can really, really help reduce the time to recovery without having the microbiome disrupting effects of antibiotics. Well, if you're not aware of that and you just want to do something, I totally empathize why it would be so easy just to say, I just want to start something. But that's where knowledge, when we have the knowledge, and that's where, having podcasts like yours and getting information out is so important, so that parents and practitioners know, hey, there actually is another way that we can be doing things.
Yes.
And you have spoken about the different modalities and your thirst for knowledge, and always kind of being on that cutting edge of learning new things and updating your practice application. And I know one of the things that you really advocate for is whole child resilience. Can you elaborate on that and tell our audience what that means and why this is such a mission of yours to make sure that every child is resilient?
Yeah. And resilience is, a lot of parents kind of think of the word resilience as more when they're thinking about psychological resilience or emotional resilience, but it goes way deeper than that. When we're trying to build resilience in a child from a mental health standpoint, an immune system standpoint, from a metabolic standpoint, hormonal standpoint, all of the things, even from an epigenetic standpoint, the idea is that we don't necessarily want to shield our kids from every single, quote, stressor that's around. We don't want to live in a hygienic bubble, with no germ exposure. And we also don't want to live in a psychological stress-free bubble where our kids have not a care in the world, because neither of those help to build that resilience. And from a cellular level, what's fascinating is that we know there's a primitive cellular response called the cell danger response that was described by Dr. Robert Navio. That's at the core of our reaction, our cellular reaction to every stressor that we can encounter, whether it's a psychological stress or an infection, environmental toxin. And when our bodies, our cells, can move through that stress and recover and heal, what happens is our cells develop a memory of how to do it even better and more efficiently the next time. So we develop this resilience. We can bounce back from the stressor stronger. I mean, there's that saying, I mean, not necessarily the most appropriate in terms of languaging, but what doesn't kill you makes you stronger. I don't like to go be that extreme, but it's, when we recover, when we allow ourselves, our bodies to go through that discomfort of being sick, or through that discomfort of, being, having some friendship drama, and we recover from it, we have the tools from that cellular level to manage the next thing that happens. And same thing with, environmental toxicant exposure. So that's what resilience is about. Because as parents, and I know as a mom, I mean, it's such the urge to protect your kids from everything. I don't ever want my kids to be sad or upset. And it's the hardest thing to watch them, be moaning and groaning on the couch because they're uncomfortable with a fever, or, crying because they had a hurtful, friend interaction. And you just want to make it right. But then if we could just sit back and remember, look, as they move through that and their bodies move through that, they will have the tools to understand how to do it better the next time, whether it's a friend thing or a fever thing, right? And I go through this with my kids too. I totally get it. I mean, I don't want my kids to be upset or sad. And then when you can just sit back and say, okay, you don't have to leave them alone. I mean, that's not the other thing too. I mean, it's not like, oh, you do your own thing, I'm just going to leave you alone. It's like, no, let's give you the tools, right? Let's use maybe some of our herbs or homeopathy so your body can know what to do in a more efficient way, without suppressing the symptoms, without suppressing the sadness or the anxiety. We're moving through it. You're giving your kids the tools, and that's allowing them to be more resilient.
Yes. There's two, I think, really big, pertinent pieces of information in this. One that you said is at the cellular level. If we think about our bodies and just our stress response, or if we narrow it down to one hormone in terms of cortisol, people get very fearful of cortisol, but it's there for a reason. It's there to respond and to protect you in certain situations. But if we aren't able to utilize that hormone, and we do stay very sheltered from any sort of outer stressor, whether it's environmental or personal, emotional, physical, then when we are placed in those positions, our cortisol is not going to know how to appropriately respond. And now you dive into more of like that pregnenolone shift where, okay, if your cortisol is spiking really, really quickly, what's being depleted on the right hand of that web in terms of your testosterone, DHEA, estradiol, progesterone, or any of those other hormones? We kind of forget that all those hormones are intertwined. And if one is dysregulated, then it's usually pulling from the other side and causing depletion elsewhere. So that's a really big concept, is in terms of stress management. And being around those stressors is normal. We all have those stressors, but it is about how you're able to perceive it and kind of move forward with it. I think the other side that you knocked out of the park was more of the mental health aspect. And something that our family talks about, me and my husband with our 4 kids, is I'm very protective of my kids' feelings, to a point where he's had to step aside and say, hey, if you step in and try to kind of protect them in this moment, you are taking away their voice. You're taking away their ability to process what's going on and to manage their own feelings and emotions and kind of decide how they feel about it. And that, as a mom, I was like, whew. You just want to protect your kids.
I know.
And you don't want
Yeah.
to hurt, but they have to go through certain things, like you said, to create that resiliency or that adaptability, or able to just deal with normal everyday life. So kind of a deeper dive question into this. If you are building a foundation of resiliency for kids from the inside out, what would you say for parents out there is the most important aspect to doing that?
Yeah. Well, I mean, the reason I wrote my book was because I want to give parents the foundations, right? That if you look at the little blue burst, read the book, but if you look at the little blue burst, it says why your child's microbiome holds the key to lifelong wellness. And, many people who are familiar with functional medicine, they know, they've heard the saying from Hippocrates, all disease starts in the gut. But I, as a parent, as a mom, as a pediatrician, I always want to take proactive steps and preventive if possible. And so we have to flip that and also realize, okay, well, if all disease starts in the gut, then so must all health. And so we have to really understand, especially for our infants, and they're developing gut microbiomes, the impact that has on their developing immune systems, their developing brains and mental health, they're developing hormones and metabolic systems. Now, it doesn't just stop. I mean, some have heard the kind of the, I don't want to call it the mythical first 1,000 days, because it's not mythical. I mean, the first 1,000 days of your baby's life, the first, 2.5 to 3 years, really are very key in establishing that foundation of a healthy microbiome that then informs whether your child's going to have a healthy immune response or maybe tip over into eczema, asthma, or food allergies, or also inform the developing brain whether or not they may be at higher risk for mental health concerns when they're older. But it doesn't just stop there, because we know there's so much plasticity and development in our immune systems and our brains, especially for kids. And what we also see is that there's this shifting of the microbiome as kids get older, and especially in the tween and teen years, there's another explosion in the change of their microbiomes. Hi, baby.
We have a guest on,
We
guys.
do. We're talking about babies. That's right. So we have this explosion in also the tween and teen years of this change in their microbiomes that mirrors how their brains are also exploding too, with these new synaptic connections. And it's really the microbiome that's driving the shift. There's a couple of studies that I point to really drive this point home, not to create fear in parents, but just to raise awareness that, one study looked at nearly 800,000 children. And it was a military study, and they looked at babies who had received antibiotics or antacid medications in the first 6 months of life, followed them out for 4 years, and found that those children had a significantly increased risk of virtually every single allergic disease by the time they were 4, compared to babies who did not receive antibiotics or antacid medications. And very likely, I mean, the researchers conjecture that the shift in the microbiome, because we know antibiotics and antacid medications, they don't just kill off the bad bugs, they can also kill off the beneficial probiotics that are trying to take hold in your child's gut, can then talk to your immune system and develop abnormal responses. In fact, we know now that the loss of bifidobacteria in our infant microbiomes is a very important cause, root factor in the crazy rise in anaphylactic food allergies and allergic diseases, right? Another study, this is a Danish study, looked at a large cohort of mother-infant pairs and also and antibiotic exposure to the baby. And this could even include antibiotic exposure when they were inside of you. Whether you had an antibiotic for UTI or sinus infection while you were pregnant. And again, antibiotic exposure, especially in the first 6 months of life, but even at any point in time, could significantly increase the risk of that baby developing mental health concerns by the time they were older or teenagers. And we know this from adult studies. One round of antibiotics can significantly increase the risk after the antibiotic course of developing a new anxiety or depression. And the more rounds of antibiotics, the higher the risk. Now, this isn't to say then, because I know, for me, hearing that and kind of going back in my mind and realizing, well, okay, yeah, both of my kiddos, even as a holistic pediatrician, both of my babies did receive antibiotics when they were under 5 weeks of age. Now, I knew they were absolutely necessary. So that's point number one, right? Are they absolutely necessary? One was for UTI in my daughter, who was 2 weeks old. Another was for my son, who had strep and basically pus coming out of his ear. I'm like, all right, that needs to be treated as a baby. He was 4 weeks old. And yet, you still kind of think, oh my gosh, what then was the path moving forward? Now, I knew to give them probiotics and, they were nursing and supporting their microbiomes. But even if you didn't know and you're looking back and your child is one of those kids, one of the many, 1 in 5 kids who has eczema, or, a teenager, one of the 3 teenage girls who is really suffering, from anxiety and mental health, it's never too late to restore microbiome resilience. The first key though, is knowing that if your child has eczema, asthma, allergies, autoimmunity, anxiety, depression, OCD, whatever it is, behavioral concerns, neurodevelopmental concerns, even if they have no, quote, gut symptoms, we want to start looking at their gut. And that's now, when you know that, you can look at their microbiome, learn how to optimize, and then move forward.
Absolutely. And we want to dive deep into that microbiome magic with you on our next segment next week. Because there's so much in that I want to unpack further with antibiotic use and what that means for parents and other options. So discoverers, keep listening in the weeks to come with Dr. Song as we'll dive deeper into that conversation of resiliency as stems from the microbiome.
Yep. And you heard Dr. Song mention her book. So make sure that you're following us on Instagram at the Discovery Doc for more information on how to win a signed copy of her book. We're going to give you all of those details on Instagram. So make sure that you're following us at the discoverydoc.com. And if you have any burning questions for the Discovery Doc or for our expert guests, leave us a voicemail or drop a comment on our podcast page. Someone wants to say something.
All to milk you right now.
Let's shift our focus to the Toxin Tamer feature, where we'll explore the nitty-gritty of how to effectively manage and reduce exposure to toxins in our daily lives. Today's toxin to tame, benzoyl peroxide.
Apparently, AK guys is upset about this one.
So bummed.
Apparently, we're upset. So before we get into why she's bummed, what is benzoyl peroxide? So benzoyl peroxide is a topical medication that we use to treat either mild to moderate acne and also rosacea. Basically, it's a topical antiseptic that works to kill the bacteria on your skin by generating free radicals that damage the bacteria cells. Oh, she wants to talk. She wants to talk.
I will wait.
So let me just tell you how this came about. So it is very new news to me. I actually had a patient who is using a compounded version of benzoyl peroxide, and our local compounding pharmacist gave me a call the other day and said, hey, this is most likely going to be pulled by the FDA soon because it turns into benzene when it's not stored properly. And
benzene is really bad.
Yeah, benzene is a colorless, flammable liquid chemical that's used in the production of plastics, resins, synthetic fibers, lubricants, dyes, pesticides, drugs, detergents, so many things. We'll talk more about why this is an issue with it turning into benzene. But essentially, if it is not stored at proper temperatures, i.e. through distribution or through, manufacturing, or then how long it's sitting on the shelves or on a truck, if it is at too high of a temperature, that benzoyl peroxide has a chance of turning into benzene. And so that is a big old problem that we'll talk about, but I want to let AK get to the fact of why she's sad about it.
Okay. So as an athlete, and back when I was personal training and teaching classes all day long, I used benzoyl peroxide as body wash because pits and parts, it helps kill that bacteria that gets you a little funky by the end of the day. And that's how I managed it. Now I'm mad because I know you're going to give us a ditch and switch in a couple of weeks, but this was a game changer because I thought it was relatively safe because it's peroxide and but it's not. I mean, it's got the benzoyl part in it, which is the toxic part and not just peroxide. So I'm interested now to stay tuned to figure out what I can swap it for to still get those same effects. And I don't know. I think you know the answer to that. I hope you know. If not, I'm going to have to do a research before we reach week 4. But that's why I'm bummed.
Yeah, I know. I understand that. There's always a better option for everything. And it is unfortunate because so many athletes and so many people use it. And now all of a sudden, quote, all of a sudden, they're like, oh no, it turns into benzene, a really dangerous, harmful, cancer-causing chemical. And all these high school athletes have been using it for how long? Or all these, like the patient I had, she's a high schooler.
Yeah.
She's young. I think she's 14, 15 years old, and applying it to your skin, which is your largest organ, the most absorbent organ. And now the FDA is like, nah, shucks.
And I've been putting it under my pits
with my
lymph nodes. And then you get, side note, if you ever get tender under your armpits, it's your lymph nodes that are blocked up. So you do your 7 points and then do all the things.
So had it drained out.
That's another story for another day. But you have to get them drained out because you have to move that fluid, because until you move your body to move the fluid, it gets stagnant. So
Yes.
Side note.
Exactly. So we will, this whole month, we're focusing on benzoyl peroxide. We'll find out where it is, where you can find it, really go in depth of the dangers of why it turning into benzene is an issue, and then some good swaps, as AK mentioned.
So empower your well-being journey with Dr. Cece's top picks for swaps this season. Sign up for a mailing list at thediscoverydoc.com and embrace the art of living well. Join us in our quest to bust medical myths. In this segment, we're diving deep into the world of health-related misinformation, uncovering the truth and empowering you with accurate knowledge. This month, we're busting 4 myths requested by the Discovery Doc community. All right, Dr. Cece, what's myth number 1?
So this one is my favorite, honestly, because it's so near and dear to my heart as a child.
Mm-hmm.
So the question is, or the statement is, gum sticks in your intestines for 7 years.
And your sister was older than you.
Yes.
And she taught you this.
Yes.
Okay. Yeah, I have a brother. He taught me this too.
Like, please tell us if you are with us on this, because my entire childhood, I remember being told that if you swallow your gum, it will stick inside of you for 7 years. And I literally would count. Like, I swallowed gum when I was 11, and I was like, oh no, 11, 12, 13, 14, 15, 16, 17. It's not going to come out until I'm 18. Like, I literally remember having this. This is a core memory of mine.
Were you looking for it in 7 years?
No, but that's how I forgot. But I remember legitimately counting and being like, oh no, okay, I haven't swallowed a piece of gum in 2 years, but I just swallowed another one. So now I have another 7 until it comes out. Listen, you are lying if you're telling me that you didn't think the same.
Yeah. And the only reason that I've ever swallowed gum is because I couldn't find a trash can to spit it out in.
Oh no. Anytime I did it was accidental.
Like I'm somewhere where I cannot spit it like into the grass or somewhere where it'll eventually decompose in 50 years. But that's the only time I've ever swallowed.
Even as a kid?
Mm-hmm.
Wow. I was like, it would be accidental. I would be talking or something, and like I would take a sip of water and accidentally swallow it down, and then I would panic. My sister also, shout out to you, Taylor, also told me that Casper, the ghost, the friendly ghost, would come out of pizza crust if I ate the crust first. Y'all.
You had to eat it the wrong way.
So I spent my whole childhood eating the crust off of the pizza first because I wanted Casper to come out.
That's adorable.
Yeah, but not true.
Did he look like Densawa or whatever his name is?
I don't know who that is.
Okay, did you ever watch the movie Casper the Friendly Ghost?
Yes,
and you remember the blonde kid at the end?
Oh, that's his name.
Yeah.
I didn't know his name.
Something.
No.
Something
like that happened. It never happened.
Oh.
Yeah, she told me lots of things that, that's what big sisters are for, apparently. Yeah. But the gum one and the Casper thing, those are 2. We will bust that myth. Casper will not come out of your pizza if you eat the crust first.
Definitely not.
So,
all right. So let's bust the myth about some gum.
Yes, we digress. So gum is sticky, right? It can chew to our shoes and our walls and our floors and our desks and everything in between. And once it's stuck, it can harden and feel immovable on the outside of the earth, right? Not in our bodies. But this does not apply to inside our bodies. No worries there, guys.
98 degrees.
Yes. For most people, gum will pass easily through the stomach and into the intestines within the normal 30 minutes to 2 hours. It typically does not adhere to the intestinal walls, and you'll poop it out just as you would any other food. 2 to 5 days later, to be precise.
Good. So go share this with your older sibling. Share this episode with your older sibling and let them know, hey, you messed with me. That was not nice.
It's not nice. No. It's not nice.
Has Ava taught that to Jackson?
No, because I don't think she's chewed gum maybe once in her life. Okay. And it was supervised in our laundry room. I had some for some reason, and she was like, Mommy, can I have a piece? But I want the other kids to see. And so I gave her like half a piece. Of course it's non-toxic, guys. Yes. Don't worry. And then the flavor ran out within like 42 seconds. Yeah. So then I had her spit it out.
Yeah.
And she was like, that's it. I'm like, that's it.
That's it.
And never since has she asked.
Good.
Yeah. And now she has expanders, so it's a hard no.
No, hard no.
Yeah.
Not with that dental work in there.
No.
All right. So until next time, let's discover together. Enter the VIP club, join up for our insider list, and receive exclusive offers and and bonuses straight to your inbox. I'll get this eventually. You guys only say it all the time. Be a part of our exclusive community and enjoy our deepest discounts. I'm serious. This closes December 31st, and you cannot get on this list any other way but signing up. And if you like to get super deep discounts, I'm talking like 50 to 75% off things that we're going to offer in the future. This being on this list is the only way to get them, and they will only be the ones to get the offer. So if you are listening to this later in time or in the future, more in the future, later time, right? What is that? You know what I'm saying.
Sometimes I just like to watch her.
Yeah.
Try to
get the brain going. Okay. So if you are seeing ads or you've gotten an email about our community or a course and it's full price, you missed out on the invite on this. So don't miss being an insider.
Wham. Bam. Thank you, ma'am.
Mm-hmm.
We hope you enjoyed this insightful episode with Dr. Elisa Song. Armed with her valuable tips on raising resilient kids, we can now create a nurturing environment that empowers your little ones from within. Remember, building resilience is a lifelong journey, so start today and watch your children flourish. In our toxin taming segment, we unveiled the potential risks with benzoyl peroxide. With this knowledge, you can make informed decisions about the skincare products your family uses. And also, who would have thought that the age-old myth about gum sticking around in your system for 7 years was just that, a myth? We hope we've debunked this tale once and for all. Hit that subscribe button for more enlightening discussions and expert insights on our upcoming episodes. Together, let's continue to explore the fascinating world of health and wellness to create a brighter, healthier future for our families. Before diving deeper into the wellness world, let's pause for a quick disclaimer. The information shared on this podcast is for general informational and entertainment purposes only. While we love being your Discovery Doc allies, we're not here to replace your doctor or healthcare provider. Consider us your fellow health explorers, sharing our findings as we uncover the mysteries of well-being. Always consult with a qualified medical professional before taking any action based on the content of this podcast. Just like an archaeological dig, this disclaimer may change occasionally, so be sure to check back for updates. Stay healthy, stay curious, and keep exploring with the Discovery Doc.